I don't want to be in the picture yet.
Huh?
I don't want to be in the picture yet.
Hi, my name is Mrs. Ogden. I'm the coordinator of CACC program, the CNA class. This is Mr. Fullhorst,
How you doing?
Kathy Jordan,
Hi, how are you?
and this is Chris Jarman. We are all CNA instructors here at CACC. We have a one-year program. We take juniors and seniors. We are teaching the IDPH required skills that when the students complete the class, they are able to sit for boards. They will have to do CPR. We do train them to do CPR. They do become certified. They have to have certain grades in order to maintain the CNA class. They have to have certain grades so they can sit for their boards. Attendance is pretty much required. You have to be in attendance. Behavior, clinical hours for IDPH has typically been in the past, we have to do 40 hours of clinical, but with COVID, they have been letting us do just 20 hours in the facilities, St. John's and Memorial Hospital. And we do the other 20 hours in our lab. We do bathing, we do the simple cares, everything a CNA would normally do is what we do. So yes, your son or daughter will be bathing an elderly male or female. Usually, typically, our patient clientele is the elderly population. We do need to have them make sure that they're knowledgeable on the 21 skills that's set forth by IDPH, which one of them is bathing, peri-care, nail care, vital signs. They will know how to do all this stuff. Requirements for clinical include background check, drug test, 2-step TB skin test. They must have their flu shot, and they have to pass the CPR. They get 2 tries. After that, we have them either go get it elsewhere or they have to drop the class, or they won't go to Google Clinical. They can opt to take the class for a grade, and that just means we're not going to get them into clinical. And we're going to show you the lab just a little bit. So this is our lab. I'll let Mrs. Jordan.
Oh, I was going to hold it while you talk. Yeah, I was going to hold it while you finish doing what you do, my dear.
Come here, Mr. Fullhorse. He was in the lab today. We do work with lifts. We have Hoyer lifts. We have sit-to-stands. We have hospital beds. We do mock everything like they would at the nursing home or the hospital. So this is our lab.
Yeah.
Let's look at it.
This right here is the Hoyer lift, which is a apparatus that we use to lift patients who cannot lift themselves. So we use that to help them. We do have sinks where they learn hand washing the professional CNA way according to IDPH. And we have blood pressure cuffs and everything here. So that is what those things are. I hope you can see them. Let's see. Yep. And then this is our lab. We have an actual bed. Tell me what's going on, John. And they see the bed here?
Yeah.
You have an actual bed with a patient in it. We have the patient in a hospital gown. We practice turning and positioning the patients. We learn how to give them baths, learn how to get them out of the bed in a wheelchair.
Learn to make beds.
Make beds with patients in it, without patients in it. Anything else?
Transferring, nail care.
Mm-hmm.
And they do have to do a lot of these things on actual people to get certified.
Mm-hmm.
The state boards, which is what the students will be able to obtain at the end of the year. Hopefully it will be done here in CACC, downstairs in the Caspin video library. And the cost of that is $75, I think, but they will have to do that. There is some cost to the program. They have to have the drug test, their uniforms, and we do make them wear their uniforms for classes. Right now, this year, with COVID being like it is, we're doing all-day clinical, but that can change next year. We have our linen carts, and yes, we do have to do our own linens, and sometimes the students will fold them. We have our mock bathrooms. We have mock bathroom stuff. so the kids can learn how to transfer patients safely on the toilet. Anyway, that is our program. Hope to see your child next year. If you have any questions, you can always call our school. CACC is 529-5431, and just have them to talk to one of us teachers here, okay? Thank you. Bye-bye.